Hello, everyone, and welcome to Creating Healthier Moms and Babies. It's a program that we put together with Parkview Health, the leading health system in Eastern Indiana. I'm Stephen Collins, CEO of Matter. We are a healthcare technology incubator and an innovation hub built on a belief that collaboration between entrepreneurs and industry leaders is the best way to develop healthcare solutions. Our mission is to accelerate the pace of change of healthcare. I am delighted to share that Parkview Health and Matter have launched our third annual Healthy Mom and Baby Challenge. Each year since 2020, we've worked with Parkview to find entrepreneurs working on novel solutions to improve maternal and child health and help foster collaborations between the startups and Parkview to further develop and test these solutions. Over the last 2 years, we've received more than 100 applications from 9 different countries, and Parkview has worked with 4 of the companies. We look forward to seeing what solutions will emerge from this year's initiative. We have extended the scope this year to solutions that have the potential to improve the lives of mothers and children through their preteen years. And this look at pediatrics with a lens on increasing equity for underrepresented mothers and children will address access to care for preventive and chronic conditions. So today we're going to learn more about the challenges faced from a group of people representing Parkview, HIMSS, the Indiana Women's Fund, and the Indiana Family and Social Services Administration. The panelists from these organizations will also discuss existing initiatives for mothers and children and areas of opportunity for innovation. And then later in the program, we'll hear from Ethel Massing, who's innovation specialist at Parkview, who will speak directly to the Healthy Mom and Baby Innovation Competition and how you can get involved. So thank you to the team from Parkview, who's been instrumental in the planning and launch of this challenge. Ethel, of course, Spencer Perkins, Alyssa Enger, Charlotte Gabet in particular, who have helped shape this effort. And of course, Jolynn Succo, who is the Senior Vice President and Chief Innovation Officer at Parkview. Jolynn has been a wonderful thought partner and champion of innovation within Parkview and beyond. We work with a lot of health systems, and the way that Parkview approaches and delivers innovation under Jolynn's leadership is really unusual and really exceptional. So Jolynn will introduce our panelists and moderate the discussion, which I know you will all enjoy. So with that, I will turn it over, Jolynn, to you.
Thank you, Stephen, for those kind words. We love working with Matter. We always look for great partners, and Matter is a wonderful partner. I want to share a little bit about Parkview Health and why this work is so important to us. Parkview is a 10-hospital system in Northeast Indiana. We have a 1,000 provider group, a small health plan, and the Miro Center for Research and Innovation, where we do clinical research and health services research, have a simulation lab, and where we host our innovation competition. We're also the largest employer in the region. And we take our role as the largest employer in economic development very, very seriously. We're also the safety net hospital in our region. And we're often the first or the anchor contributor to helping solve a lot of our region's problems. So this competition really helps us bring together the best of who we are in terms of being both a large economic force in our region, but also a company that works to solve problems. So I'm really excited to be here today. We have an incredible group of panelists from the local, state, and national level. And I'm going to introduce them. And as I introduce them, I think they'll turn on their cameras. Erin Norton, seated to my left, is the Director of Community Outreach for Parkview's Women and Children Service Line. Cassie Beer, also to my left, is the Women's Fund Director at the Community Foundation of Greater Fort Wayne. Valerie Rogers, online, is the Director of the Government Relationships Team at HIMSS. David Gray is a Director of Government Relations and Connected Health Policy at HIMSS. And Elizabeth Wall is a social worker at Indiana Family and Social Services Administration. So welcome and thank you so much for joining us. I'm really excited about the discussion. So Cassie, I think I might start with you.
Sure.
The Women's Fund of Greater Fort Wayne has conducted a lot of studies on our region and how to make Allen County more equitable for women. Tell me more about some of the actions that you're taking at the Women's Fund.
So the Women's Fund exists to use research, education, and advocacy to try and work on systems level change for issues affecting women and girls in our community. We have 3 focus areas: economic security, our young women and girls, and personal safety.
Fantastic. Well, as part of your research, I saw that 26% of women in Allen County in 2020 did not seek out healthcare due to cost. What steps can we be taking to help these mothers who do not seek out care due to cost?
So it's really interesting in that study. It does say 26% didn't access because of cost. It also says that around 28% don't access because of their schedule too. They don't have the flexibility in their workplace to be able to take off time to take themselves, take their kids to the doctor. So one thing that the Women's Fund is doing is educating employers on what are policies, benefits, workplace shifts you can do to help keep women in your workplace, like providing flexible work hours for women to be able to take themselves or their children to the doctor, things like that. So we're focused on the economic side of how can we really empower and educate employers to realize that these things help them keep and promote and retain women in the workplace when they provide opportunity for women to seek out healthcare, provide quality health insurance, provide opportunities to have flexibility in their schedule to take care of things like that.
That's fantastic. So just before this panel, we were also talking about the Women's Fund focus on personal safety. And can you share a little bit more about the exciting work that you're doing in that area?
Absolutely. So we split personal safety into 2 initiatives. One is a domestic violence court. The national average for domestic violence is 1 in 4 women. In Allen County, it's 1 in 3. And Allen County is known nationwide for our problem-solving courts, but we do not have a domestic violence court. So a domestic violence court provide really great wraparound services and accountability. And so we're really advocating for that to happen. But secondly, we work on sexual assault. Our rate in Allen County is 30% of women have experienced sexual assault. And one thing that we've heard as we've convened our community partners like the YWCA, Sexual Assault Treatment Center, Victims Assistance to the Fort Wayne Police, is that survivors don't know where to go to access the specific help they need. We heard stories from the YWCA sharing that they're driving people to Sexual Assault Treatment Center to get a forensic rape kit because they can't get one at the YW, they can't get one in a hospitals, emergency rooms, excuse me. So we also heard about college students not being able to access Title IX websites on their college campuses because the links are broken, or on and on. So we decided as the Women's Fund that we were going to own this, that we were going to provide the online resource to help survivors access what they need quickly. So today we launched a new campaign and website called No Matter What. And it helps to clarify if it's been 5 days or less, go to the Sexual Assault Treatment Center and get a forensic rape kit so that you have that evidence if you want to use it. And then from there, you're able to filter out financial, legal, shelter, and it directs you exactly to the local resource you need to find that help. So we launched that website today, and then we're putting the QR code on stickers for public restrooms. So we're inviting anyone with decision-making power over a public restroom to reach out and get some stickers to place so that survivors can discreetly, quickly, accessibly access the help they need.
Thank you. That is so exciting. Elizabeth, Indiana was one of 8 states funded by CMS for the Indiana Pregnancy Promise Program. Tell us a little bit about this 5-year grant focused on mothers with substance abuse disorder. How does it extend to other needs like mental and behavioral health?
Hi, thank you so much for having me. I am the program manager for the new statewide Indiana Pregnancy Promise Program, which is housed at the Indiana Family and Social Services Administration. PROMISE is actually an acronym for Promoting Recovery from Opioid Use, Maternal Infant Support and Engagement. And really what the Pregnancy Promise Program offers is a multi-generational approach to supporting pregnant Medicaid beneficiaries with current or past opioid use disorder, offering enhanced case management and care coordination supports beginning in the prenatal period and extending through 12 months postpartum for both the parent and the infant to really reduce the negative impacts of opioid use on both parents and infants. And I will say we launched this program on July 1st of 2021. So we're really rounding out the first year of enrollment of the statewide program. And by and large, the majority of our enrollees have multiple mental health conditions in addition to opioid use disorder, such as depression, anxiety, stress-related mental health disorders. And really, we know that by and large, the population that we are serving has experienced a lifetime of trauma and adversity. So in addition to wanting to reduce stigma, increase access to care for our population, including prenatal care, mental health care, and behavioral health supports, we also aim to address the health-related social needs of the family, like safe, stable housing, adequate nutrition services, transportation, and those types of services as well. So we try to be very comprehensive with respect to this program.
That's terrific. I'm going to pivot a little bit to Valerie. Valerie, leveraging data, utilizing new tools and resources is extremely important for us to take action on improving maternal and child health. Can you talk about the ways we are leveraging data to support mothers?
Absolutely, and thank you for having me. As a part of the HIMSS government relations team, and HIMSS being a global advisor and thought leader, member-based society, we are very much committed to reforming the global health ecosystem through the power of information and technology. And given the plethora of information that we have at our fingertips now, we definitely believe in supporting and advocating for strong investments for those tools and resources that can be actionable at the state, at the local and community level to support the turnaround in the maternal mortality crisis that we're seeing here in the country. So very much we are focusing on leveraging state investments in telehealth and remote patient monitoring. What is really interesting is that through the pandemic, it really sort of rose to our attention and was highlighted maternal mortality and other chronic and infectious diseases that are infecting women, and how access to some of the digital tools, technologies, and information that gives us more detail about the populations that we are hoping to support through these crises are really sort of left out of a lot of the funding streams that would support them. So HIMSS has been very involved, and my colleague David Gray will talk about some of our federal initiatives and advocacy for Momnibus, but we are also very active in supporting states. We believe states should match the investments in communities, particularly those with the highest maternal mortality rates. And that also includes supporting active engagement of birthing hospitals, licensed birthing centers, perinatal providers, really to inform their quality improvement efforts and regular reporting at the state or regional health information exchanges. And we're really happy to see that Indiana has stood up one of the strongest information exchanges in the country. And that, along with the work of the Indiana Management Performance Hub, I think really stands out in terms of opportunities where we believe that state omnibus should support. And that includes digital self-monitoring for women, leveraging Medicaid programs for little to no out-of-pocket cost to the patient. That also includes increasing and improving reimbursement for care, starting with preconception through all phases of pregnancy and the first year postpartum. And really thinking about ensuring integrated telehealth models for maternity care services, especially for those in rural environments. And I would also just call to attention the opportunities that exist now to use technology-enabled collaborative learning and capacity models for pregnant and postpartum women. All of these opportunities really come together to support a more well-rounded approach in tackling this crisis that we're facing. And I guess I would just end by saying that we're also very much aware of some of the gaps that we've seen in the data collection and our vital record systems. So there's a maternal mortality, maternal health is really a part of a larger conversation around health equity, but also around data modernization. And as I mentioned, having the exchanges, having data hubs, having the opportunity to leverage these data in different ways and from different avenues to inform and improve surveillance and research on maternal health outcomes is really going to put us ahead of this crisis.
I really appreciate that. And I feel like you anticipated my next question. So I'll change it up a little bit. But if you had a magic wand for a day, what would be your top gap to close from a data perspective around maternal and child health in our country?
Gosh, it's really hard to pick one, but I'll be good and narrow it to two. Number one, I think it's the expanded use of telehealth and leveraging some of the Medicaid reimbursements in the states where they exist. I think the expanded access to care and the care coordination component that must be related to that, which calls for a lot of interoperability across the spectrum of care. And in order for us to address some of these health equity issues, interoperability is key. And, lastly, I would just say that the gap that we have seen in our surveillance and reporting, especially at the national levels, really has to improve. Our maternal mortality review boards at the state level, I think, can play an integral part in ensuring that we don't see those 10-year gaps and that we are able to leverage through the data that's collected from the sources aforementioned to really take action now, more real-time action.
Thank you. Thank you so much. So I want to pivot to your colleague, David. A lot of initiatives and support will be determined by what states do, but there's also a need for federal policies. Can you talk about some of the federal policies that support healthy mothers?
Yeah, absolutely. And, thanks so much for having me as well. Just take a quick step back. The question you asked Valerie about, having a magic wand, the root causes of the maternal mortality crisis are so widespread and really deeply entrenched in our healthcare system that really any single change we can make at the state level, at the federal level, doesn't matter if it's big or it's small, will really have an outsized impact on the lives of pregnant and postpartum mothers everywhere. It's really the sad fact is that really any baby steps we can make will really have a tremendous impact. But back to the question you asked me, you're right. States really do have a critical role in supporting initiatives and programs and policy changes tailored to the different needs of their populations. And throughout the country, states are really finding innovative ways of using, limited resources in a lot of instances to address specific issues, a lot of which can be replicated across the country and are being replicated across the country. But, to your point, federal policies are really the biggest drivers for nationwide adoption of change. we've seen over the last couple of years, policy changes impact the state's ability to extend postpartum coverage for up to a year, establish maternal mortality review committees, as Valerie mentioned, address workforce shortage areas. So what happens at the federal level is really crucial. The slightly good news is that in a mostly divided and hyper-partisan Washington, D.C., addressing the maternal mortality crisis has been one of the few issues that has received overwhelming bipartisan support, and has also had a couple of successes that they can really show as making some changes. So two points that I want to raise. First is the fiscal year 2022 omnibus bill, which was signed by the president in March and funds the federal government through September 30th. That bill had a number of key maternal health provisions. It included nearly $1 billion across various HHS agencies, which is a 4% increase over FY21 to support maternal and child health programs aimed at reducing maternal mortality and severe maternal morbidity. This was funding for HRSA, CDC, Office of Women's Health, Office of Minority Health, really all HHS agencies that play a role in overall maternal health. The omnibus bill also included two key pieces of legislation, bipartisan pieces of legislation: the Maternal Health Quality Improvement Act and the Rural Maternal and Obstetric Modernization of Services Act, or the Rural Moms Act. The Maternal Health Quality Improvement Act authorized funding to support training programs to address and prevent bias and racism in the provision of prenatal, labor, birthing, and postpartum healthcare services, and authorized funding to identify, develop, and disseminate best practices to improve maternal healthcare quality and outcomes. And the Rural Moms Act, as the name implies, it's really focused on improving maternal care, specifically in rural areas. What this bill does is it improves rural and maternal obstetric care data collection and quality, allowing the CDC to coordinate efforts with states and other agencies on maternal mortality and morbidity, and really emphasizing research on pregnancy-related deaths. And it also included It also updated the Telehealth Network and Telehealth Resource Centers grant program to include providers of prenatal, labor care, birthing, and postpartum care to support increased telehealth adoption for maternal health care. So, those are policies they've been signed into law. They're already being implemented as we speak, and we should hopefully see some of the fruits of these bills over the next couple of months and years. The second point that I want to raise at the federal level is the Black Maternal Health Momnibus Act of 2021, which is commonly shortened to just the Momnibus. This bill that was drafted by the Black Maternal Health Caucus is a package of 12 bills, also introduced as standalone, that really seeks to build on existing legislation to comprehensively address really every dimension of the maternal health crisis in America. The bill already has 177 co-sponsors in the House, about 30 co-sponsors in the Senate, which is about 40% of all members of Congress, as well as the support of over 250 state and national organizations. So this is a really popular bill. It's gaining a lot of traction. Hasn't seen a lot of success yet, but we're still very optimistic, and this is one of HIMSS's key policy priorities for 2022. What's specific to the Momnibus bill, this is it's a very long bill. I could probably spend over an hour going through all the various provisions, but at a high level, as I said, it really seeks to address every single issue associated with adverse maternal health outcomes, whether it's investing in social determinants of health, improving bias and supporting bias and racism training programs and research, supporting pregnant veterans, supporting incarcerated mothers, growing and diversifying the perinatal workforce, supporting maternal mental health and substance use challenges, addressing climate change related environmental threats, et cetera. It really covers a broad swath of issues. But two bills that I do want to point out for this group here is first is the Tech to Save Moms Act. This would make significant investments to promote the integration and development of telehealth and other digital tools like remote monitoring and self-monitoring to close racial and ethnic gaps in maternal health outcomes. Telehealth is going to be such an important tool to increasing access to care, especially for rural and underserved areas, that this is an issue that HIMSS is really, really supportive of. And the other bill that I want to call out is the Data to Save Moms Act, which would support greater levels of community engagement and greater participation in maternal mortality review committees, as well as support improvements in data collection, the quality measures that are used for maternity care, and as well as support maternal health research at minority serving institutions. Out of the 12 bills that encompass the Omnibus package, one has already been signed into law. A couple others have been passed by the House, and others are still waiting action at the committee level. The Democrats' reconciliation bill, the Build Back Better Act, which is it's now no longer being touted, but the Build Back Better did include all of these provisions from the Omnibus Act. So there is a big push in Congress to continue addressing these issues. So that's something that HIMSS and our partners in the space are really going to be focused on. Sorry, that was kind of a long answer.
No, that's fantastic. And, I always feel hopeful and excited about our competition. Anytime you can hear bipartisan support of something in our hyper-polarized environment gives me hope. Does HIMSS have, and I don't know if we can put this in the chat, for people who are interested in learning more about these, do you have something on your website that participants could learn more that we could put out?
Absolutely. This is Valerie. In the chat box, I've included a resource for developing digital tech-enabled maternal health report with some very specific recommendations specifically to those at the state and local level. And just one last really quick thing, for those of you who are looking comparatively across some of the state legislation that has been proposed, omnibus-like legislation at the state level. California just late last year passed their state omnibus. Both North Carolina and Illinois also have pending legislation in support of really strong data and surveillance supports leveraging health information and technology as well. So those are a few that you could take a look at.
Yeah, and the one thing I'll say also is, while the Omnibus bill does have support from 40% of Congress, it's not enough. So I'll also post this in the chat, but HIMSS has a legislative action center campaign in support of the Omnibus, so urging your elected federal officials to join as co-sponsors and urge congressional leadership to take up the Omnibus bill, whether it's a whole package or standalone bills. So I'll put that in the chat, and it would be great if everyone would take a couple of minutes to contact their elected officials.
Well, thank you both so much. It's exciting to learn what's going on at the national level and really how it impacts us here locally. So with that, I'm going to turn to Erin Norton, who serves in our service line here at Parkview Health and deals with the front line of maternal and child health. So Erin, 31.1% of mothers who gave birth in 2019 did not receive prenatal care beginning in the first trimester of pregnancy. And that's a statistic from the Indiana Department of Health. What barriers of care do we often see?
Well, Jolyn, there are a lot. Our healthcare system is not always that easy to navigate. And that might actually be even more so for some of the people we're trying to help with this contest. For women who are 18, 19, 20 years old, this may be their first experience making a doctor's appointment on their own. They might not know who to call, where to go, some of just the basic, very simple, fundamental steps. They're not always that simple. For immigrants and refugees, there are a lot more concerns. For example, if a woman has had her first 4 children in a refugee camp in Thailand, and had little, if any, prenatal care at all, it's going to be a big shift for her to get any prenatal care, much less, within that first trimester and as many visits as we want her to get. And then there are also social determinants of health. Does this person have transportation to get to and from the doctor? Do they have childcare to watch their other kids? Cassie mentioned earlier, will their work schedules permit it? Because if you have to choose between getting fired from your job or going to a doctor's appointment, you might choose to keep that income to keep a roof over your head. And then also insurance, another thing that is difficult to navigate. And if you don't have insurance, how are you going to pay this bill? It's a scary thought for a lot of families. And then also for some women in a domestic violence situation, this could be a very scary topic for her. It could make her partner volatile. And then also if she has mental health challenges or substance use disorder, this may simply not be her top priority. And so we have a lot of things, a very comprehensive list of things that need to be addressed.
We're not short of challenges and need of innovation. I was so hopeful after we were talking about Momnibus. So I think about infant health, and it's so impacted by the health of the mother. So pre-pregnant health, early prenatal care, and a positive environment postpartum contributes to a strong start for kids. So for a lot of moms, postnatal support and care isn't easy to find or make time for. So what resources exist for those moms, and where do we have gaps?
So we're lucky that we have a lot of really good mental health therapists here locally and throughout the United States, as well as support groups that are in person. And there are certainly a lot more online support resources these last couple of years, but it's simply not enough. We know that a lot of good therapists have very long waiting lists. And if you're in an acute situation, waiting 6, 8 or weeks or longer is simply too long to get the help and support that you need. And for a woman who is struggling with depression, with mental health issues, if she makes a call, it might take all of her energy to make that first call. And if she gets a closed door, she might not have the energy or strength to make another. So opportunities to feel like there's going to be help on the other end for whatever call you make, I think is really important. And then of course, when we talk about mental health, we're always thinking about stigma. And then we want culturally competent caregivers. We know women from other cultures who speak other languages need support from people who understand that culture and even speak that language. And then of course, practical support, the childcare, the support, and the difference between, do I get mental health care if I have to pay a lot out of pocket, or should I be using that money to pay my rent or keep the lights on? It makes for some really difficult choices for moms. But for a lot of women, especially who are struggling with mental health, they tell us that they feel like they're drowning. So I think that whatever we do, the solution needs to feel like a life raft and not like a brick. We can't make it another chore for them.
I like that. I like that visual a lot. A lot of moms have chronic conditions like diabetes and hypertension that will contribute to the health of the baby. How can we better support those moms?
So Joanne, you said the word chronic conditions. And I think that's a really key thing to remember, is that we don't need to wait until a woman is pregnant or has a baby to talk about or care about her health. And so in my opinion, we need to prioritize women's health in general, so that we are addressing these issues prior to pregnancy. And I like to use the analogy here of a road trip. If you and I were gonna go on a 9-month-long road trip, we would want to make sure that our car was in good working order before we started. We don't want an oil leak. We don't want smoke coming out of the engine, because we know that this car needs to make it for 9 months. And then also, we just care about women's health, period, regardless if she's pregnant or not.
I can't. I could say amen. I would. I often think about, you wouldn't take a car on a 9-month road trip that was breaking down. And if you were going on a 9-month road trip, you'd be planning it probably because you'd have to take time
Absolutely.
off work. So you'd be planning it well in advance, probably years in advance, and thinking
right.
about those things well in advance of the trip.
That's right.
So this year, the Healthy Mom and Baby Competition has a track for children between 18 months and 12 years of age. There are several areas such as childhood obesity and ACEs, where Indiana has poor outcomes when looking across the nation and in comparison to the nation. There's also a number of areas like regular preventative checkups and vaccinations that we're looking for solutions for. What should people keep in mind when looking at solutions for this group of kids?
Okay. Yeah. When we're talking about kids, we need to remember that we just can't look at a child in isolation. This child's a part of a family. We need to consider what this family is going through. If this is a single parent household with several kids, mom's probably going to be working at least one job. She's going to have a lot of other responsibilities, especially if any of those children have chronic health conditions or concerns or trouble in school or all of the things that children drive us crazy with. They've got a lot going on, families in general. And then we also need to consider what this child's environment is like. You know, when we talk about obesity, where are they shopping for groceries? Is it at the local gas station or is it at a full service grocery store? Do they have access to fresh fruits and vegetables? Is the neighborhood a safe place to play outside? Or is this child kept inside in an apartment because it's not safe to go out and really play in the neighborhood? And then I also just want to mention that we can't really just talk about individual behaviors when we're talking about kids and families, because not all families have good options to choose from. So I would encourage everybody today to really look at this from a system perspective and not just at the individual level. We really also need to look upstream.
So this competition is calling for solutions from entrepreneurs and others who may not have had healthcare experience. What is one thing from your point of view these entrepreneurs should keep in mind when creating their solutions? And I would open that to the entire panel.
So I'll start. I would say we need to look at upstream approaches, midstream approaches, and downstream approaches. We need to address them all. You might want to think to consider.
Yes, I would second that. I feel like with the Women's Fund, we see that if we aren't addressing the root issue of some of these, so the root cause of some of these issues, it's just going to continue to snowball. So, you know, I would consider that looking at the big picture and looking at what are some of the root causes of some of these big issues we're seeing and how can we start to address those, go further, like Erin said, upstream. One of my favorite quotes is Bishop Desmond Tutu saying, we have to pull people out of the river, but at some point you have to go upstream and figure out why they're falling in. So I feel like if you can figure out how to go upstream, that's a really great thing to keep in mind for this.
Valerie or David or Elizabeth, I don't know if you have answers to that question as well.
Well, go ahead, Elizabeth.
Oh, thank you. I would just echo the other panelists too and emphasize, yes, we can think of the individual in the context of a family. We can think of the family in the context of a community. And we can think of, you know, the community in the context of a broader system and culture. So keeping all of those pieces in mind, solutions are within all of those sort of concentric circles, I think.
Valerie or?
Well, I would just add, you know, I think a lot of those folks that are developing like digital solutions, applications, could really start to work with mothers at the community level to really find out what might really work, what their needs are, and create solutions around that. I don't think, you know, digital aspects have to be sort of one way. I think it can be, we can learn from the community and really create solutions that would really work for them, that would work for mothers. And I think that there's the world's like our oyster in terms of what could be created that would support mothers, both, while pregnant and postpartum.
Fantastic. I don't know, David, if you want to close us out.
I don't have much else to add that hasn't already been said. The one thing I'll close with is, the maternal mortality crisis in this country is not new. It's been around for decades. It's gotten worse over the last 2 years, especially as women have been unable to seek out care. And I think one silver lining of the last 2 years is really this renewed focus on this issue and really seeking to resolve it. There are a number of really great opportunities and policy solutions that can be implemented and are being implemented. It's definitely not a problem that's going to be addressed with a bill. It's really going to take a village. It's going to take all of our efforts to try to address all of the underlying root causes. But I'm optimistic. I'm more optimistic and hopeful about a path forward now than I have been. There really is such a tremendous focus being placed on tackling this issue once and for all, and reversing the negative trend that we've seen over the last couple of years.
Well, thank you. And I want to thank our panelists. This was fantastic. It's wonderful to get the perspective at the state, local, and national level on many issues that affect women. With that, I have the privilege of turning this over to Ethel Massing, who is our innovation program leader, who will share more about this incredible competition.
Well, thank you, Jillian, and thank you to our panelists. I don't know about everybody else, but I just got chills today, just hearing from everyone really talking about this problem. Again, like David said, this didn't happen overnight, and a solution won't come overnight. But as we continue to work together, we can find real solutions to this issue. So with that, I am very pleased to officially launch our Healthy Mom and Baby Innovation Competition 3.0 for 2022. You'll show the next slide, please. So as in years past, we're still interested in finding solutions that reduce maternal and infant mortality. However, this year, as Stephen said, we're really expanding the competition to include mothers before, during, and after pregnancy and their children up to age 12. And we're specifically interested in solutions for underrepresented members of those groups. Next. So as you can see on this slide, we have 3 tracks this year for participants, and we're really interested in solutions that can close gaps in care and especially tackle chronic conditions. So again, as you see on the slide, you'll see conditions like diabetes, mental health, hypertension, asthma, epilepsy, autism. But we also know that Indiana mothers and children are behind in their preventive care and receiving vaccinations. So anything that, again, can help close those gaps in care and help get them those routine services would be excellent. And you'll really see in track 3, that's the biggest change in this year's competition, that we're not just looking at mothers and infants, we're really looking at the whole family. And again, mothers even before they're pregnant and their children up to age 12. And if you look at the next slide, you'll see our timeline for the competition. We actually opened our application period on May 2nd, and thank you to those that have already submitted applications. We're excited to see those coming through already. This application period will be open until June 24th. And at that point, we will have about 7 semifinalists that we'll select, and we'll announce those on June 29th. And then we'll have a period where we spend some time working with those semifinalists on their final pitches. And then those semifinalists will present at our innovation competition on August 10th. Now that's going to be a hybrid event this year. So we will have an in-person portion. And If you're a participant who can't come in person, that's okay. That's why we have a hybrid event. And I know they're going to drop the link to register for that event. The registration's already open as of today for that innovation competition. So if you want to see those solutions, you can go ahead and register. So again, the semifinalists get selected. They present on August 10th. Then from those, we pick 3 to 5 finalists that we put through an extensive accelerator program between us and Matter Health. And those participants get a wealth of resources, again, both from Matter and from Parkview. I know last year our participants got more than 50 hours of mentoring from Parkview providers, including our facility services, biomed, purchasing, payer contracting, all of the above. Anybody that you need to talk to, you will have access to during that accelerator program if you're chosen as a finalist. And then on November 10th, we'll have our final pitch day where we'll choose the final winner who has the opportunity to do a project and a pilot project with Parkview Health. So again, why should you apply? Looking at this next slide. The prizes of the innovation competition include that opportunity to explore a pilot or partnership with Parkview, $10,000 of a cash reward, and a 1-year global membership with Matter. And I will say, if you look at our 2020 winner of the innovation competition, Candlelit Therapy, we are actually kicking off their research project next week that they work together on. So we're very excited about that. Nua Surgical, who is the 2021 winner, we are currently in the development phase with their pilot project, and they'll be kicking off later this year. So really, really valuable experiences for both the finalists and then those who win. So who can apply? The simple answer is almost anyone. Really anyone with any kind of idea that can solve issues for our mothers and children are able to apply. You don't need a company. In fact, in 2020, we had a team from Parkview who came with just an idea and a 3D printed airway. And from the mentoring they got from us and Matter, we've since launched a company with them, and now they're actually selling products. So you can look them up, Safe Sleep Simulation, but you don't have to have a company to apply to this competition. We're looking for great ideas and we can help you with the rest. It doesn't matter where you're located. You can be here in Indiana, you can be from Parkview Health, you can be all the way across the globe in Ireland or India or Russia, where we've gotten competitors before. Also, again, the accelerator and the other parts are a hybrid format. So don't let geography be the determiner whether you apply, because we will work with you no matter where you are. And I know Gina just popped up some more links there, and there are links in our website to the terms and conditions if you're not sure, if you want some more information on the rules. But if I still haven't convinced you that you should apply yet, I have a surprise guest for today's call. And I actually made a crawl across the pond to Barry McCann from Nua Surgical. Nua Surgical is the 2021 winner of the innovation competition, and they actually won the pitch competition as well. And like I said, we are currently working with them to develop their pilot project. But I have Barry on here to give you just some insight on, what was it like to be part of this competition, Barry, and why should other people apply?
Thanks, Ethel. I'm delighted to be invited back, I suppose, to tell the tale of Nua Surgical and I suppose our involvement with both Parkview and Matter. It's hard to believe that, it was nearly a year ago that we had applied, and fast year, an awful lot went on in the meantime. And I think certainly from our point of view, getting this underway and having the whole competition process has been a huge plus for Nua Surgical. I suppose to start off, Nua entered this competition because our company is dedicated to innovating in maternal and infant health. And as far as I'm aware, this is the only global innovation competition run by a healthcare system that is focused in this space. And for us, that was really important. That was a major pull factor. I suppose at Newa Surgical, we've developed the patented Stericision C-section retractor, which is going to deliver safer outcomes through improved access and visualization during surgery. So we wanted to get this message across, and we wanted to show that it'll enable clinicians to safely deliver a baby, identify bleeds, and prevent prolonged complications as well. Winning this competition for us certainly added further credibility to Newa. And I think it'll do the same for any startup that's planning to apply. The fact is really that I suppose it's judged by both VCs and experts in maternal and infant health. So that further validates both the unmet need that any company is working on, but also the investment opportunity as well. Our prize, as I think you've kind of pointed out earlier, was the pilot partnership with Parkview and then a year-long membership with Matter. And I hope both of our partners agree that we're certainly trying to make the most of this amazing opportunity. You kind of touched on it, Ethel, that we're using the Parkview partnership to conduct our human factor studies, which will be eventually as part of our FDA submission. So that's activity that has to be conducted on US soil. So for an Irish company, it's amazing to have this partnership with you guys over in the US. We've already spent 3 days working on site with your clinicians there. And thanks to both you and Spencer for, I suppose, continuously to work tirelessly to arrange interviews and meetings with all of your experts there. As you know, we're also currently planning both our second and third visits back to visit on site for further human factor testing. Then when it comes to Matter, I suppose the benefits of the partnership are very different to Parkview, but then extremely complementary as well. So in a nutshell, Matter has provided our company with access to industry experts across the spectrum of healthcare, and then all of that for free. So again, a shout out to Sam and her team. You've supported us with every request. And I think especially for an overseas company, it's been a massive help to introduce us to the right people in regulatory or reimbursement, and even investors that are qualified to support us for our specific needs. I think we definitely believe that the partnership with both Parkview and Matter could help springboard, I suppose, Stericision to get to market faster. And we're going to try and make the most of the opportunity for the remainder of the year as well. I'd like to finish maybe by just saying, for everyone that's considering the opportunity and planning to apply, I would definitely say go for it. I think Newa Surgical winning last year is real evidence that it doesn't matter where you are based in the world. If you fit the bill for what they're looking for, and as Ethel mentioned, you know, that is pretty wide this year, and you don't necessarily have to have a company. I think absolutely go for it. It can work, and it'll certainly pay off for both you and your company and whatever technology you're developing going forward. And then just lastly, if anyone wants to reach out to me, they'll easily find me on LinkedIn, and I'd be happy to discuss, I suppose, our journey in greater detail, or if I can support anyone kind of going forward. So thanks a million again.
Thanks so much, Barry. And I know they dropped the link to Newa Surgical. If you want to find out more about them, the link to their website is in the chat as well. So thank you, Barry. I hope that did it for everyone. We really enjoyed working with Newa Surgical, and we really hope to find another company like you this year. So with that, again, I want to thank all of our panelists for a great afternoon of officially launching Healthy Mom and Baby 3.0 competition. So with that, thank you, and we'll close out today's program. Have a great day.